Hi, I'm Dr. Khurrum Shaukat Yusafzai, Hyperbaric Medical Specialist. Today's video is about the treatment protocol, that how one takes hyperbaric medical treatment and how it is done. This is the question on the minds of many people, and they ask how it is performed and how it is done. So when the patient walks into the clinic, he is dealt in the same way as any other specialty, that the patient is examined by the hyperbaric medical doctor and he performs certain functions which is sort of mainly like any other specialty like surgery or medicine, with examination of the patient, investigations, and also determining the fitness of the patient to undergo the treatment. So I will talk in detail about all these functions in this wonderful video. So let's begin. Today I'm going to talk about hyperbaric medicine treatment protocol and the workflow. That how a person who wants to undertake hyperbaric medical treatment, what processes he undergoes. So we will discuss the processes, which are also known as the workflow. And this video is the proud presentation of the Ksybiz Hyperbarics, Ksybiz. And these are the social media networks through which you can contact us if you want to undertake any hyperbaric related operation, and we would like to help you. So let's describe what is hyperbaric medicine. Hyperbaric medicine is actually defined as treatment via a high pressure vessel. So because of the high pressure, it is called hyper. And baric means oxygen. And the environment is created to treat different diseases by varying the dose and the time of oxygen. The mechanism of action in hyperbaric medicine is increase in healing about 3 times and increase in the interstitial capillary oxygen 15 times than the normal. This increasing the energy production, the ATP unit formation is increased, and because of this increased and enhanced activity, every cell of the body works 3 times the normal function, especially the immune system, and that results in beneficial effects, and it increases in the stem cell activity. And it's also known as the epigenetic treatment, where it cures the DNA. The guidelines for hyperbaric treatment is the textbook of hyperbaric medicine, and there is updated 6th edition currently in use. And there is another textbook which is known as the textbook of diving medicine for diving related conditions. So there are many reference books as well available, which are in hundreds, which also provide the hyperbaric medical treatments, and there are a million research articles in the different database in the universities. These 2 textbooks have been used for hyperbaric medicine and oblique diving medicine, and I will talk about them, how these textbook of hyperbaric medicine covers the physiology and the pathophysiology of the diseases which are treated by hyperbaric medicine. The diseases are discussed according to the system like nervous, circulatory, hematological, and emergencies, etc. in this textbook. Each and every disease which the hyperbaric medicine treats is discussed, and the protocol of the treatment is provided in this textbook. So this covers all hyperbaric related topics. It discusses the gases and the different gas laws, the mechanical aspects, also the physiological aspects, pathological, and how hyperbaric medicine is changing the medical treatment scenario. The second textbook, known as the Textbook of Diving Medicine by Bove and Davis, is in 4th edition currently. This actually covers the basic diving physiology, the pathophysiology of decompression sickness, which the human body experiences while diving under the sea. And it also provides the guidelines for the physical fitness of the diver. It also helps in diagnosis and treatment of diving related disorders and much more. Discusses special consideration for female, elderly, and pediatric divers. Covers diving related problems in people with pre-existing conditions. These are the reference books which are used also and loved by the physicians and the consultants who work in the field of hyperbaric medicine. Especially the book by Paul Harch, and the one which covers the hyperbaric medical practice, and the one talking about the neurological disorders is very famous. Actually, hundreds of these books exist, and some covers the anti-inflammatory properties, and some talks about the countless wonderful effects which the hyperbaric medicine gives. There are actually hyperbaric reference book for the allied health professional like the nurses and the safety technologist. So these books actually help the non-physician staff who work in the hyperbaric medical field. And there are also books covering about the hyperbaric facility safety, and they also provide you guidelines how one should run a hyperbaric medical service. So pretty helpful knowledgeable materials are available if one wishes to properly conduct hyperbaric medical treatment. Hyperbaric medical technologists are also examined by different bodies, just like the physicians are examined. So patient selection criteria, how we select the patient. So the approved treatment list are over there as in the textbook of hyperbaric medicine, and different societies around the world which are in each continent, they provide the guidelines which diseases are covered and which are not covered, and which diseases they should pay, the insurance company should pay or not pay, which I have covered in another video. In the continent of America, there is also label and off-label diseases. So these diseases are actually comes only in the continent of North America, in the USA, because the FDA regulates which diseases, and mostly they are emergencies which are on label. The off label one are actually the rest of diseases, and unfortunately they are not paid by the medical insurance companies, so you have to pay out of your pocket. But in the continent of Europe and the Oceania, like Australia and New Zealand, most of the diseases are paid by the medical insurance companies. And in Asia, a lot of insurance companies do pay, and actually people pay out of their pocket. And a big network exists in China, Russia, Japan, South Korea, and also India and Pakistan and Singapore, etc., Malaysia. So now we discuss the hyperbaric medical treatment protocol, that how it works and how we conduct it. Basically, it's not very different from the rest of medical specialties. For example, if a person wants to undertake a treatment, first he goes to a general practitioner or a specialist. So when he goes there, he actually refers the patient to the hyperbaric medical doctor. Same as it happens in other specialty, this is also a specialty just like surgery or medicine, that you have to be referred from another doctor to go there. Although for other ailments, one can just walk in. So as you can see that you can be referred by a GP or a specialist doctor, or you can be referred from one hospital which does not have a hyperbaric facility to a hyperbaric standalone clinic, or one specialist polyclinic can refer you to another clinic where the hyperbaric facility exists, as you can see. Or you can walk in directly. For example, if you're not having a disease, but you want just to do it for health and vitality reason, you can just walk in and take the treatment. So you do need a prescription for that. So these are the ways where you can start the hyperbaric medical treatment, and I hope you would understand how to take it. So the protocol of the treatment is about 1 hour long, and this is done by a hyperbaric medical consultant. He would examine the patient and also read your history, and he would go back and see your documents, which if you have a medical record with you, or maybe he gets the medical record, and he will determine the fitness, that if you are able to undergo the hyperbaric treatment or not, because there are some contraindications to hyperbaric medical treatment, which maybe I'll talk in another video. If you are found fit, then you can undergo the treatment. And the opinion of other medical specialists or surgeon or any specialist doctor is also incorporated in this decision-making process. And then when he writes a medical prescription, which consists of sessions of which you will have to take, and how long, like 60-minute or 90-minute, and then how many breaks you should be having. And then when a prescription is written, then a patient schedule is made, and then the patient is made to undergo the treatment. So if he undergoes the treatment, it has to be paid by the medical insurance companies, otherwise he has to pay it from his own pocket. And the process of medical insurance is that a F form is raised, and if approved, then you don't have to pay from your pocket, and all your treatment is paid by the medical insurance company. So this is how the process works. So let me describe the process. Like if you are approved for treatment, then how you will take the process of hyperbaric medical treatment. The process is, I will describe in a glance, that after referral, when you come to clinic, and how the consultation will start. So that will be in red color, and then when you have the fitness, that will be in yellow color, and then how the treatment. So let me show you a wonderful graph or a diagram, that how you will take it. As you see in the red, 1 hour consultation is being done, and after referral from another specialist, and when the referral is completed, in the yellow you can see the process of fitness for treatment, and when you are fit, then you go to the green box, which is the treatment itself. So these are the colors I assigned. Red, that when you are referred; yellow, when you get fitness from the hyperbaric doctor; and green, when you start having the treatment. So I'm going to describe in a detail this 3-step process, that after you are referred, when you have the fitness, and when you undergo the treatment. As you can see, that there are the patient is referred to radiology and the lab for investigations in the process, like he can be maybe referred to another specialist as well in the process of this fitness for hyperbaric treatment. So this process is done by the hyperbaric medical physician. He actually determines by these investigations from the lab, from the radiologist, and from the opinion of other specialists, he would make a professional opinion that you can take the treatment or not, or the treatment is beneficial for you or not, so that your money is well spent or not wasted, and then also satisfy the medical insurance companies that they should pay for it. So this is the workflow in the red, yellow, and green color, and in the blue color is the post treatment assessment, or maybe when the records are completed. So as you can see, that the patient undergoes this complete workflow, and then while he's undergoing the treatment, there are some tests, HBOT treatment test, then post hyperbaric test as well, like checking the blood sugar and things like that, oxygen level, and maybe an ECG, or it depends on the doctor, like whatever he likes, and he orders his medical staff to check you up. So when you finish the treatment, then the medical records are completed, as in the blue. So this is the detailed workflow of the referrals, like maybe from the marketing department, or walking patients, or referred patient from other physicians, or special activities. Maybe some people learn from magazines or newspapers, and then they come over, and then there is future expansion. So this is the way how the hyperbaric specialty works, because it's just like any other specialty. And when a person goes to hyperbaric, he should expect the same thing which he expects in other specialties. So this is the detailed workflow of the consultation, like when the hyperbaric physician has first consulted you and the investigations he orders, then maybe he refers you to other consultants, and then in the second consultation, which may be 1 hour long as well, he would check the investigation results and the opinions from other specialists, and then he will form his final opinion, and then he will give fitness for undergoing the hyperbaric treatment, and the medical records are then updated. The medical records will typically have a prescription, a medical file with all your details, and the record of all the investigations, and even the opinion of other specialists, and medical insurance record, etc. In the green, that when the fitness has been taken, so before each hyperbaric session, you have to wear a certain dress, and you have to be prepared, and there are actually some precautions before you can go inside the hyperbaric chamber. So after these are done by the medical staff who are highly trained in hyperbaric medicine, there is a pre-hyperbaric oxygen treatment, some checks like sugar level or blood sugar level and blood oxygen level and the vital signs, just like in any medical or surgical procedure. And during the session, the hyperbaric staff check for any metallic or electronic objects on you. If it's over there, he will not let you take it. And post HBOT, the tests are repeated, and then medical records are updated. So that when the medical records are updated, like everything, the investigations, the whatever tests will happen pre-hyperbaric treatment, post-hyperbaric, even record the progress of the healing, like how you have improved, because the record from the other specialist it will determine that the hyperbaric has helped you or not. So this record is very helpful for the physician, and they can assess you that how effective it has been. So based on that, further decision making process is done. So as you can see, this is like a completely professional medical specialty, and it can treat wide variety of diseases like any other specialty. And very soon you will be seeing a lot of hyperbaric medical consultants all over the world. Nowadays it's a rare specialty and you don't find it, a lot of doctors, but very soon this is going to change. So I thank you very much from me, and if you have any questions regarding any hyperbaric related query or about diseases, as I'm the hyperbaric medical consultant, and I will be glad to help you in this regard. And you can email or WhatsApp me or contact me via my Facebook page. I hope you liked my wonderful video, and I thank you for being with me on this wonderful video. And in order to see such wonderful videos, please subscribe my channel and press the bell icon for notification of the new videos which are uploaded. And if you want to contact me, please contact me on the social networks scrolling down below. And I hope to see you soon again on my Ksybiz hyperbaric channel. So I hope to see you soon. Thank you and goodbye.